Hi, my name is Florence Ajayi Barnes, your virtual family nurse practitioner, and welcome to the Flo-Medical Show, where you get information and education you can trust. On the show, we talk about health, being an educated consumer, and you being your own best advocate. Disclaimer: this is valuable information, but please consult your healthcare provider. Today's topic will be on cataracts. Cataracts is the clouding of a normally clear lens of the eye. Most cataracts develop gradually over a course of years. According to the National Eye Institute, over 24.4 million Americans over the age of 40 will develop cataracts. By the age of 75, over half of all Americans will have cataracts. According to the World Health Organization, cataract is the leading cause of blindness in the world. It accounts for over 51% of blindness. Cataract is seen more often in women than in men. It is seen in Caucasians than other races. But the prevalence of cataract in the Hispanic community is steadily rising. We often see cataracts at the age of 60 years old and older, but we do see cataracts at the age of 20, 30, and 40 years of age, even at birth. This is because as we age, the natural arrangement of protein in the eye breaks down. When it breaks down, it clusters together, causing cloudiness of the lens, subsequently causing cataracts. What are some of the signs of cataract? It's when you have decreased vision, unable to see in dim lighting, or if you're having a circular type of halo motion when you're looking at a light source. So for example, if you're looking at a light bulb or you're looking at a headlight and you see a circular area around the light, it's like a halo type of vision. Also impaired or decreased vision. Those are signs and symptoms of cataracts. There are three different types of cataracts. You have the nuclear sclerotic cataract, the cortical cataract, and the posterior subcapillary cataract. Let's go over the three cataracts and see what the difference are between the three. The first one, which is the nuclear sclerotic cataract, is nuclear, like nucleus, which is the brain of the eye. Sclerotic is hardening, and cataract is the cloudiness of the lens. So with this cataract, the most common of all of them is when you have yellowing and hardness of the lens inside of the eye. You have the cortical cataracts. This is the cataract that is occurring on the outside, exterior, around the shell. So it's working its way from the outside of the lens towards the central area of the lens. And the same thing occurs. You still have the clouding of the lens. Then you have the posterior subcapillary cataract. Posterior meaning back, subcapillary underneath, and cataract, which is the cloudiness of the lens. So this particular cataract is occurring in the back, underneath, towards the center of the eye. All of the cataracts basically affect you the same way. It decreases your vision and it causes the lens to be cloudy. It is just they're occurring in different ways. It is important that when you see these signs and symptoms or you have impaired vision, that you have this evaluated. How do we diagnose cataract? Most often, if you have a decrease in vision, you will go and see your healthcare provider first. Your healthcare provider will take a medical history. We want to find out if there's anything in your medical history that's putting you at high risk of having cataract. It could be family history, it could be you having hypertension and diabetes. We want to know if you have a precursor to having any type of visual issues. And then we find out what are your signs and symptoms? How long have you been having them? Once we obtain this information, we will also do our own test, which is the visual acuity test. Most of us all have had a visual acuity test done, even from childhood. This is a test in which you look at a chart, the Snellen chart, that is filled with letters of varying sizes. And the more you can read further down in the chart, the better your vision is. Our goal is 20/20. So the further you move away from having 20/20 vision, we will recommend that you see an ophthalmologist, which is an eye specialist. We would want to know if there's anything going on in your eyes that's causing you to have a decreased vision. This ophthalmologist will do their own set of tests. Some of the tests they will do will be a slit lamp test. This test will help them to see the front of the eye under high magnification, which is now the lens of the eye is being seen under the microscope and the structures of the eye are much larger. So then they're able to see if there's anything going on in the eye. They will also do a retina examination, a retina test. The retina is located inside of the eye, and that allows us to receive light coming into the eye. So your eye doctor, which is the ophthalmologist, will dilate your eyes so that the lens are now wider and they can see the lens and they can see the retina under higher magnification to see if there's anything that is affecting the eye. And lastly, they will do a test, which is the appellation tonometry. This test helps to measure the fluid pressure in the eye. The fluid pressure in the eye, the higher it is, will put pressure on your optic nerve. And the optic nerve is the one that controls the eye and allows us to see. So the higher the pressure, the more risk you have for decreased vision in the eye. So once your ophthalmologists have done these various of tests, they can determine if you have an eye condition, if you have cataract, and if you have, what kind of cataract you have. The most important thing is not to ignore the symptoms you're having. So it's important to know, when do you go and seek treatment for decreased vision? It is when it's affecting your quality of life. It's affecting you writing, you reading, you being able to see in a dim lighting, you working, doing your hobbies. If any one of those are affected, it is important that you go and seek treatment. The treatment for cataract most often is surgery. That all depends on the severity. If the ophthalmologist seems to see that it's small, they will continue to watch it. But if the cataract is getting larger and it's affecting your vision and it's clouding the vessel and it's clouding the lens more, they will decide to have surgery. Most patients are reluctant to have surgery, and that's understood. That is affecting our eye. So I understand when they are reluctant to have surgery. But I do know that when they are informed, they have a better rationale of knowing why they should have the surgery, and most of their fears are decreased. So let's go through the steps of what you can expect if in event your ophthalmologist feels that you need to have surgery for your cataracts. First, your ophthalmologist will give you a date of when the surgery will happen. You will need a medical clearance. That means you will see your healthcare provider to do blood work, an EKG, and also maybe do a chest x-ray. This lets the surgeon know that you are medically stable to have this surgery. Once you've gotten this medical clearance done, the day of surgery arrives. You must come with someone to the surgical center. Why? It's because you're going to be having eye surgery. You will have decreased vision, and it's for your safety. So you go to the surgical center with someone. When you get there, your surgeon will give you medication, which is a sedative to help you to relax. This medication, once given to you to help you relax, will allow us or the surgeon to go into the eye. Cataract surgery is not a major surgery. It is considered ambulatory, one day, same day surgery. That means you have the surgery and then you're going home the same day. Also, during surgery, you are awake. You're not being put under anesthesia. It is local anesthesia that is applied just to the eye. This is better because one, it allows you to wake up faster. It also allows the communication of you and your surgeon and the healthcare team. And it allows us to know how you're feeling, how you're doing, how's your pain. So you are awake during the procedure. But at the beginning of the surgery, we'll insert an injection or drops into the eye to numb the eye. Once they have done that, they will also give you some more drops to lessen the pain that you may occur during surgery. It is now that he or she will insert the new lens and remove the old cloudy lens. This procedure takes an average of 10 to 20 minutes, of course, depending on the severity of the cataract. Once the lens is put inside of the eye, your surgeon will now put a dressing over the eye and put a shield over the eye. This will help to prevent the eye from getting any injury to the eye. You will now be led to the recovery area. The recovery area is where we monitor how much pain you have in regards to how you're feeling and your vital signs. If in the recovery area they feel that you're able to go home, the person that escorted you to the surgical center will now escort you home. You will get an appointment to return back to see your surgeon between 1 to 3 days. That is so the surgeon can see how the eye is coming along. Most patients have reported that they've seen a significant increase in their vision in just that short amount of time, and it gradually increases over time. You get the maximum benefit from the surgery between 3 to 10 weeks. When you return to see your healthcare provider, they make sure that there's no swelling, make sure the pain level is okay, and they make sure that your prognosis is going as it should. The great thing about cataract surgery is that the lens lasts for a lifetime. Also, most people can obtain a 20/20 vision. And then cataract surgery has a 98% favorable rate. So not only will you be getting the surgery, you have a higher quality of life, you have a surgical procedure that is going to last your lifetime. And then not only will you have increased quality of life, you have increased visuality. There you have it. You have the information, know what to look out for, and you know the treatments. Please like, subscribe, and share this information with anyone you feel can benefit from it. My name is Florence Ajayi Barnes, your virtual family nurse practitioner, and thank you for joining us on the Flo-Medical Show. See you next time.